Hey Derek, this is Ben. I wanted to go over an orthognathic case with you. I know you were talking about doing some collaboration. I'm not really sure how we can do that if you're in Connecticut and I'm in Oregon, but I like where your head's at, and I know you do a lot of orthognathic surgery, so I think this is a great introduction to TScan, and it maybe all we need to do is I just come out and train you or a colleague how to do what it is that I'm going to share with you. So this is an orthognathic case that I want to share. Obviously, by looking at the case, we've got some crowns done in the anterior fore, and the occlusion looks really good, right? It doesn't look too bad how he interdigitates. I don't really see too much wear and tear. Gums don't really have any recession to speak of. We've got a little occlusal wear in a couple of spots. A little flattening here, a little flattening here, and some obvious other spots, but I don't see a lot of abfractions or occlusal disease, although this patient does suffer from terrible headaches, terrible migraines. And so this is the left side as seen in the mirror, how things interdigitate. This is the right side as things come together. Maxillary view, mandibular view, and then clearly you can see that we've got hardware, and he's had some advancement. This particular view here, section, is I'm just checking the condyles to make sure that they are well adapted and well corticated, and certainly doesn't look like he has wear and tear on either one of these joints, although I just chose the left joint to show you. So I run through some biometric scans of his joints. This is a joint vibration analysis, and you can see when he opens and closes. Here's the close stroke, here's the open. So as he closes, he's got a pop, and as he opens, he's got a click. So all of that is on the right TMJ. Left TMJ sounds pretty good. There's a lot more energy in the right TMJ, so could be something to look at on the right side. It could also be counterlateral side if this is trying to adapt to whatever's going on the left, but that's not really what we see. And this is his T-scan. So when we look at that perfect interdigitation of his teeth, it doesn't look so perfect anymore. So he's got 63% of his bite is on the right side, which is the same side he's having joint clicking and popping with, right? And then 40% is on the left. So you can see these are indicative of force. Two things that we notice here is these spikes are bigger than these spikes, and the color gradient is different. So blue is low force, green is kind of middle of the road, and then when you get up into the yellow and orange and red, that's high, and then pink is an unknown quantity of force that is so high the machine can't read it. So generally speaking, you initially want 2 to 3 pinks to kind of give you a guide. That's your sensitivity setting, because you wouldn't want all of this to be pink, you wouldn't want all of this to be blue, because it's not going to tell you anything. So with this bite configuration, he's got more muscular output on the right temporalis than he does on the left, and makes sense. He's actually biting more on the right than the left. But 253 millivolts versus a 193 millivolts in a MIP clinch. So once you use the computer to kind of guide how you're going to balance out his bite and do it, what you see is a pretty tremendous drop in output of the muscles. So now we have 42, or we'll say 43 millivolts on the right and 60 millivolts on the left. But you can see he's much more balanced as far as the force goes, and right and left he's within 5 percentage points, right? So that's kind of my wiggle room, 5 percentage points, but he's no longer what he was, and the bite's a little bit more balanced. So it's not unusual to me that his migraines that were primarily on the right side have dissipated. So and actually gone. He's not taking medication anymore. So this particular patient, as well as to kind of extrapolate to other orthognathic cases, I think it's valuable that this is a finishing step in these orthognathic cases that you may be doing to kind of bring around a higher level of finishing and care when these patients. Plus, they're much more stable when the force is evenly distributed between all the teeth. I'm going to be around for this weekend, traveling a little bit for Thanksgiving, but I hope you enjoy the video. Let's get back the first week in December and see how we can help each other and our patients. Have a good Thanksgiving.